Welcome to For the Record, an unfiltered view on current trends and timeless advice for surviving in the aesthetics industry. Whether you're an injector, practice owner, sales rep, or marketer, it's time to set the record straight. Each week we cut through the chaos and showcase diverse perspectives and winning ideas from the best minds in the industry. I'm your host, Dr. Tiffany Hall, Chief Growth Officer at Aesthetic Record. Now, let's get started on this week's episode. Hey guys, welcome back to another episode of For the Record. And Season 5 is off to a great start, and we are cruising into aesthetic next time. And have with us today one of the stars of our show, if I do say so myself, doing live injections this year, several lectures, sitting on a really cool panel about before and afters and kind of comparing techniques. We have with us Gilbert Saenz, who is from Dermatology Plastic Surgery down in Austin, Texas, one of our neighbors. He is a 20-year PA who has done both dermatology and plastic surgery, so really the best of all the worlds. He has been on a crusade, I think, around the country, speaking at conferences, doing live injections, really showcasing his skill set and helping to transition all of us into some of these new techniques and new devices that we'll talk about today. But he is a joy to be around, among all other things, and a true genius in all things aesthetics. I am thrilled today to welcome you to our show, Gilbert.
Thank you, Tiffany. It's such a pleasure to be on here, and I genuinely appreciate you inviting me on the show.
Well, I had no idea that we had such a great Texas neighbor until I met you a few months ago in Colorado. I was like, hey, that guy's really sharp. And now here we are. So it all works out. But I saw you on stage in Colorado talking about weight loss, body contouring, really a lot of interesting things that are hot topics right now. And so you truly are an expert. And you sit in a plastic surgery office, which I think makes it so cool and so unique for you. So we're going to unpack all the things today. But I want to start first with really your journey, because you, like I said, you are both dermatology and plastics, all the world. So give us an idea of where you come from.
Yeah, absolutely. So, my journey actually started initially in family medicine. I graduated PA school in 2002, and I spent about maybe 3.5 years in family medicine before making the transition to dermatology. And that was probably one of the best decisions I could have made in my life. I love family medicine. It really gave me an amazing foundation for medicine and a good understanding for what medicine is all about. But I really wanted to kind of explore a specialty like dermatology. And I've always just kind of been drawn to aesthetics. And so it just seemed like a natural progression. And so I started my career in dermatology. I spent 16 years in dermatology before making a transition to plastics, which has been such an amazing experience in and of itself. During my time in dermatology, I met a plastic surgeon by the name of Dr. Johnny Franco, who is the owner and head surgeon at Austin Plastic Surgeon. And this was maybe about 7 or 8 years ago. He actually joined the dermatology practice that I was at, and they had hired him as a plastic surgeon to expand services to the dermatology patients. He had just finished up his fellowship, had just moved back to Texas from Miami, where he had been learning all the latest and greatest procedures in aesthetics and Brazilian butt lifts, which is really his passion, his love, body contouring. And we became fast friends. He invited me to be his first assist in the OR, and we just became really great friends, and I consider him my best friend. And then after about 1.5 years or so, he kind of decided to start his own practice, Austin Plastic Surgeon. But unfortunately, I couldn't follow him right away just because of contractual obligations and non-competes and all that mumbo jumbo. But over some time, we were able to kind of reconnect professionally. We remained friends throughout the entire time. We would see each other quite regularly on a social level, but professionally, we were able to reconnect about 3 years ago. It'll be 3 years in December that I joined his practice, and it's been such a great experience.
Well, if you don't know who Johnny Franco is, you're living under a rock, because he's got a big personality. He's a lot of fun to watch on podium, and I think he just went through a tremendous weight loss himself with GLP-1s. I was listening to him talk about that and the rebound effect and all the things that have happened to himself as he's gone through this. I think he's got a really close handle on what's happening, and you're seeing it all from the surgery perspective, but also then coming into the clinic, I'm guessing, and having follow-up things done and, on and on and on for, forevermore. But from that perspective, looking at dermatology and plastics, I think it's such a cool combination. Our CEO of our company has come from both as well. And I'm sure what you know about the skin is just incredible, but also the surgical part of it. Give us an idea of like what the benefit for you is as a PA, because I think this is the reason I ask. Because I think a lot of people come in from medical school and they have all these different experiences, right? But if you come from nursing school or PA school, you may not have all of those different specialties and things under your belt. And so I just think there's such a value to looking from the OR perspective into how things are done, from a dermatology perspective into the skin. So what do you know, Gilbert, that nobody else knows because of what you've been doing?
I'll tell you, I've actually been quite fortunate in my experience because I've been able to work with some really amazing surgeons in the plastic surgery side of things. Previously, in the dermatology side of my career, I worked with some really amazing dermatologists and Mohs surgeons, and I learned so much about the skin. I mean, it is incredible how much there is to learn about the skin. My practice at the time consisted of all aspects, all facets of dermatology, from clinical dermatology to surgical dermatology to aesthetic dermatology, which is truly my passion. But it encompassed everything, and I really got to understand the skin really well throughout my time and my career on that side of things. But surgery is such a different side, and it's been so great to really work with some of these really amazing surgeons. As I mentioned, Dr. Franco is truly an artist when it comes to body contouring. But I've also had the pleasure and the privilege of working alongside one of our other surgeons, Dr. Adam Weinfeld, who specializes in facial procedures. And that is really where I feel like my career just skyrocketed because I'm a huge proponent of cadaver courses. I will fully endorse cadaver courses for anyone who is starting out in aesthetics and injecting because it is imperative to understand the anatomy. It is so important, and it's so helpful to learn from these cadavers. And I am very grateful for these people who have donated their bodies to science so that we can learn. But it's a totally different experience to be in the OR and be seeing the anatomy live in person, being as the layers are being dissected away. I feel like that truly has allowed me to really just flourish in this field.
I could not agree with you more. And shameless plug, we have a 6 hour course this year to Aesthetic Next because it is such a big deal. We're like, we can't do it in 4 hours. You got to come to six. But I couldn't agree more that you need to see a living human with blood flowing in their veins, the tissue pinked up, the dermis is still thick, like all the things that are real. I think cadaver courses give you a great roadmap, but you need to actually like drive the topography, like get in your car and drive it. And I think that's a human. But, I think people undervalue how important it is to go to an OR, find a surgeon in your market, in your area, and say, hey, can I come shadow you for a couple of days, just watch you in the OR, watch a facelift, because you just cannot compete with that kind of access. I just think it's such a critical part of it. But you also do a lot of adverse events, and I'm guessing from that,
Mhm.
because of your background, you probably have a very unique ability to assess and diagnose and treat because you've done all these things. So I think you're doing some ultrasound, some different things with complications. Give us an idea of kind of what that looks like for you in a practice where you have, you've got surgeons who are, standing behind you, but you're doing a lot of that
Right.
yourself and taking on a lot of that work. So how does that sort of workload shift, and how much do you do versus what they do?
Yeah, so that's really interesting. A little backstory to that. It started out very self-serving because I had been so fortunate to have not had any kind of major complication occur with any of my previous patients throughout my career, and I wanted to ensure that I took care of my patients as best as I could. So I really took this deep dive when ultrasound kind of started gaining some traction. I decided to really just dive into it and try to learn as much as I could so that I could be not only proficient at injecting, but proficient in being able to manage patients should a complication arise. And beyond that, I also kind of came across, I kind of found, I don't know how it happened. I don't recall, to be quite honest, but I found this group of aesthetic providers, professionals that really just wanted to learn and share ideas about how to manage complications. And that is a group that's based out of the United Kingdom called the Complications in Medical Aesthetics Collaborative, or CMAC. For those of you who are not familiar with it, shameless plug, I guess, but really great opportunity to share ideas, learn from some of the like providers, aesthetic providers that are at the top of their game from across the world. And I traveled to London to go attend these conferences. I've been 2 years in a row now, and I'm planning on going back again this fall because it's such an amazing conference, and they do such a great job of sharing all of this valuable information. And from that, I've taken these opportunities to really kind of just help not only myself but my fellow colleagues within the practice uh, kind of understand how to manage some of these complications a little bit better. And we have had quite a few patients come to us who were referred to us specifically but because we have an ultrasound within our practice and we are able to visualize where some of these products are either improperly placed that are causing some sort of a compression or some sort of an occlusion or some other complication. And we've had quite a few patients referred to us specifically for that reason. And I'm very proud to say that we've been able to help every single one of them, and no one has had any long-standing complications come from it.
Well, that's first of all, that's great news in the end there that no one's had anything come from it. We do a lot of cadaver courses here that we record and produce for other people. I just got back from one with Dr. David Sadat, but I always love to go to those and hear the adverse event management parts of it. Of like Steve Yolen, he's like, I put hyaluronidase in the facial artery, it goes everywhere it needs to go. Put it in one spot, let it work. Others, it's
Yeah.
all targeted with ultrasound, and they're guiding their injection, and it's so specific. And then people do all these kinds of different things. They have hyperbaric chambers, and they're doing just various parts and pieces to make it into an entire protocol. And I think groups like CMAC, shout out to Lee Walker, who's a genius, but groups like that help to really pioneer new ways of doing things. I think we've been flooding areas with hyaluronidase for so many years, and it's not working in some cases. We don't see the result we want to see, and we're spending a fortune on it. The patients are uncomfortable. It's miserable for them, and to really get not a great result. So I think these things like ultrasound are making a significant difference and being much more specific in our care, but also, I mean, to your point, people don't have long-term problems. Like, what a benefit if you're an injector in a market like Austin to know that somebody in your market can come in and help you. If you're in the place where you're like, I have no idea what to do next, I am totally screwed. What's going to happen next? It's like, oh, you got a guy. I know a guy. I just think every community you need. If you're an injector listening to this, go find that person in your local market or in your surrounding area, because you at some point, if you do it enough, it's just law of averages, you will need it. And whether it's you needing it or someone that gets referred to you and you can't help them, where do they go from there? I think that's just as important as your protocol for treating it is to where to go next if you can't treat it. And I think we just kind of forget about that part sometimes as we kind of plan out our steps here. But to that point, I digress, Gilbert. I digress. Speaking of ultrasound, though, are you using it like point of care when you have a patient come in to just get a regular injection? How do you use it like on the day to day, or do you use it day to day?
I use it quite a bit. I don't know that I necessarily use it every single day with every single patient, but I do use it quite a bit, certainly for any kind of complication management. But I do a lot of I guess higher risk treatments. One of my favorite treatments to do is a liquid rhinoplasty. I love liquid rhinoplasty. I think it's such a game-changing procedure. You can have such a huge impact on somebody's self-esteem and how they just kind of carry themselves. And obviously, I think anyone who has been in aesthetics knows that liquid rhinoplasty is not something that's done by just anyone. And so I use my ultrasound as a way to kind of map the area that I'm going to be treating prior to treatment, because obviously I want to do everything to keep my patients safe. And by using the ultrasound to map the nose, I can see if there are any vessels that may lie in the areas where I'm planning on treating. And if there are, then I'm not above telling that patient, you know what, I don't think this is a good idea. I think could be pretty risky. And I'm in a fortunate position where I can tell that patient, I think if you truly want to do something about this concern that you have for your nose, let me refer you over to one of our many amazing surgeons. So vascular mapping is one of the things that I use it for. We use it quite a bit also for some of our neurotoxin treatments where we're trying to target specific muscle groups. For example, the trapezius muscle for the quote unquote Barbie tox or trap tox, for calf muscles, other areas where we're trying to be very precise and specific with our injection points. We use it for visualization of where we're injecting our neurotoxin. And then also in some areas to really just try and identify that we're placing the product in the appropriate place, in the place that we want it to be, where it's avascular, where it's safe, where it's giving us the best, outcome and projection for that particular treatment.
Yeah, I think it never hurts to look, right. I think there can be an over reliance on it, but we talk about aspiration, and we have for how many years we discuss aspiration, and no one can do it well, right. Your hands move, you move into a different place. It's just not foolproof, and I think people feel good about it at night when they go to bed, but I don't know that it actually solves the problem. I think ultrasound is just so much better at what really lies beneath the skin. And I love that you mentioned toxin because people don't talk about that at all. And I think that's a genius way to use it because people they think about filler and they think about complications. It's like toxin to me is the most complicated thing that you do because muscles have their own way of working, right? We're filling an empty spot with filler. We find a hole, put it in the hole, life is good. Toxin, you are changing the mechanistic underlying way that the body is working. I just think there's such a bigger problem there, but drop brows, everyone gets them all the time. It's just a thing that happens. And we never discuss it, Gilbert. We don't talk about it. We talk about occlusions like they happen every day, all day, and they just rarely happen. But toxin adverse events happen literally in many practices almost every day in some way. So we undervalue how much the specific injection or the really intense study of where it needs to go, how much that matters in toxins. So I'm glad you mentioned that. And by the way, trap toxin, I don't get it. I want to look like a Hulk. I want to have muscles. I think relaxing that it's a little too feminine for me, but it is the thing. Everyone's doing it, right? It's all the rage.
Yeah,
How
it
many
is.
units does that take on average for a trap?
We treat our patients at minimum with 50 units per side, so 100 units
So
total.
if you're in the business of making money, that's a good extra add-on. It's like doing masters. It's a
It
good
is.
add-on. So those of you who are listening to this, if you've got an ultrasound machine, you can find out how to do it really well with your ultrasound device. But that's a lot of units. I think, if we're looking at money making, toxin is like, we just keep inventing areas, right? Every year there's a new area to use with toxin. It just keeps producing money. Like
Absolutely.
it grows on trees. It's great.
I love the ultrasound. I think I think it's not necessarily in its infancy, but certainly, something that's kind of gaining familiarity and popularity, I guess you could say. And I kind of joke tongue in cheek a little bit, but it's like it's my X-ray vision, it's what allows me to see under the skin, it's my superpower.
And it's hard to do. I think we undervalue also how difficult it is. Like I said, I've been to a million cadaver labs. I do CMEs like it's my job. I guess it really is my job. And I see ultrasounds all the time, and I'm like, I don't know what the heck I'm looking at. And I'm a pretty intelligent person, and I've heard it enough that I should know. And I think about coming into this as a brand new nurse who's fresh out of school. You're trying to figure out ultrasound. It's hard to do. You're trying to use it in a tense situation when things are chaotic and you're, in a panic. It's one of those things that you kind of have to phase, I think, into it over time. Like learn what you're doing today, and then maybe the next step is to get ultrasound in your practice and really study with that and get proficient with that. I think it takes time. It's not an immediate thing. I mean, there are people who do this every day who still have confusion when they look at an ultrasound of like what's what and where things are. But rhinoplasties, yes, I've had one, and so I won't get a liquid rhinoplasty ever because I've had a rhinoplasty and I'm so scared that I don't want to lose my nose. I mean, it's not very cute, but it's the one I got, so I want to keep it as long as I can.
I love it.
But let's go into the body because I think that's where one of your big shining places that you do a great job. And you're one of the pioneers, I think, with Aveli, which is this new cellulite device that I find very novel. As we all know, we've had some bombs in recent years, Gilbert, in the cellulite market, and people think it just can't be done. But I think you're proving otherwise. So I want to hear about how you think about this device. What you told me on the phone one day was that it doesn't require like a big machine. It's not expensive to do for you. That it's actually pretty low, low overhead for the practice, but it has amazing results. So I don't know enough about it, and I think our listeners probably don't either. So give us an idea of what it's all about and how it works.
Absolutely. So Aveli is the brand name for the device to perform a procedure called targeted verifiable subcision. So anyone who's been in aesthetics for a while, especially on the more like surgical side, may be familiar with a old treatment known as Selfina. Selfina was around for a little bit some time back. I don't even know if it's truly on the market anymore. I think it kind of fell out of favor a few years ago. And then we had the injectable procedure treatment called Quo, which I think most of us who have been in aesthetics for a few years know that Quo, unfortunately, or fortunately, depending on how you look at it, was pulled from the market for some of the secondary things that would come from it with regards to hemosiderin staining, skin discoloration, things of that nature. But I digress. The Selfina is kind of what I wanted to use as an example because Selfina was one of the original variations of this subcision treatment. So, the way cellulite kind of affects the skin, and I would love to go into it in more detail, but maybe you'll just have to come and see me at Aesthetic Next, so that you can kind of get a little bit more information on it. But essentially, there are these bands of tissue that kind of pull the skin down, creating that dimple. And what Selfina would do is it would cut those bands to release the tension on the skin, but it did it in such a haphazard way that it created a lot of trauma to the underlying tissue. And so it was very complicated. Well, let me rephrase that. It caused a lot of swelling, a lot of inflammation that was uncomfortable for the patient, that was not necessary. Fast forward a few years, we have Aveli, which is a handheld device that essentially helps you identify exactly where the tissue band is. You can verify that you are pulling on the exact area that you should be addressing. And then with the press of a button, you pretty much just slice right through it. And so it's very precise, which is what changes it from and makes it so much more, I guess, beneficial and so much more successful in comparison to some of its predecessors. And so it has kind of changed the game in terms of cellulite treatment in our practice for sure. And I think that as time goes on and more practices become aware of this procedure and become familiar with it, it's going to just change the way we look at cellulite as a whole. Being a practice that focuses a lot on body contouring, it kind of just made sense for us to bring it on board.
Well, and I think it's a problem that every female, I don't care how skinny you are. I mean, I'm a teensy little thing, and I've got cellulite, and if you're big, you have cellulite. Everyone has cellulite. It is it's a pandemic, frankly, Gilbert. It is a female pandemic. We all have cellulite, but we all know we have it. We just deal with it. We move on. In summertime, you're like, oh God, not the shorts again, not the skirts again. And I think you kind of dread it depending on, who you are and the severity of it. And we have all been so excited over the past many, many years to have it all fixed. And every time we get excited, we get let down again. And I've had many friends who did Selfina. They walk around in these like bandage things for days and days and days. It is very painful. I think in the aftermath of it's not so great. Obviously, Quo had some concerns. And I think people are just kind of gun shy. And also because initially, like with Selfina, you had to buy the whole device. It's quite expensive. You have to pay it off, hoping that you get patients in to come do this. I think your new device is maybe not quite nearly as expensive, but also just the downtime and the overall, the theater of getting it all done. I think that's part of it too, is you have to have all the things beforehand and wearing the garments and all the staining that was happening. It just seemed like what? In second thought, my shorts are my shorts. I'll let it go. But give me an idea of like how that looks for the patient coming in from the time that you start marking until it's finished and she's on her way wearing her, her skirts again.
Yeah, absolutely. So to kind of piggyback on your point, cellulite is something that affects approximately 80 to 90% of women across the country for sure, and quite possibly, globally. I'm sure there are probably some ethnic backgrounds that maybe don't deal with it quite as much, but it is certainly something that is quite prevalent. To answer your question, so someone comes in looking for treatment of cellulite. We would set them up obviously with a consultation. Typically, we try to do the consult before the procedure, but sometimes the patients are ready to do the treatment then and there. But it does become a bit of a scheduling issue. So wanting to make sure that we have enough time set aside for the patient to do the procedure itself. But the consultation basically consists of the patient, myself, and my medical assistant in the room discussing the cellulite that bothers them. We do an evaluation with the patient in front of the mirror so that we can all visualize, the dimples that they see. There's a little bit of education that takes place because not everything that we see on the back of the thighs and the buttocks is true cellulite. Some of it might be skin laxity, which is another interesting topic that we could cover at some point. But it takes a little bit of educating the patient to understand the difference between skin laxity and true cellulite dimples. When we identify the dimple on treatment day, we mark the dimple so that we can identify where it's at, because once the patient is laying prone on the table, those dimples may not be as easy to see. So we mark them to identify them. There is a procedure that takes place that involves numbing the patient to make this entire procedure more comfortable for them. We use something called tumescent solution, which is a combination of saline solution. In our case, we use something called lactated ringers, which has a little bit of a bicarb buffer in it. We add lidocaine to it. We add tranexamic acid, which helps minimize bruising, and some epinephrine to minimize bleeding. And we use that to mess the entire treatment area. And we treat not just the dimples that we're treating themselves, but also the pathway to get to those dimples, because the Aveli device is a handheld device that has this long probe. And so we want to be able to make this as comfortable for the patient as possible. Once a patient is numb and fully tumesced, then we make a tiny incision, typically at the gluteal cleft. I'm sorry, not the cleft, but the crease where the butt meets the thigh. And that's where we introduce the device into the tissue. And then we just basically kind of follow our pathway that we created to that cellulite dimple and release it one by one. And that's, again, what makes this so different from all its predecessors, is that we can treat the dimple individually without having to cause too much excessive trauma or collateral damage, so to speak. The procedure itself, depending on the number of dimples, can vary in time of length, or length of time, I should say. And typically, it's somewhere in the 1.5 to 2 hour range, depending on the number of dimples. Once we're done, the patient is then post-operatively cleaned. We make sure that everything is dry, and we put some bandages on the patients. We put some ABD pads, and then we put them in some compression shorts. And those compression shorts are like basically biker shorts that they'll wear for approximately 2 weeks, is what we encourage. And they'll wear them approximately 23 hours out of the day. So the only time we really want them out of those biker shorts is if they're washing the compression shorts, or if they're in the shower. Otherwise, we really want them to have that compression so that the tissue can heal nicely.
Yeah, so it's still a lot of things. It just seems like it's way less invasive. But side note, you mentioned bicarb. If you're using lidocaine on a patient, throw some bicarb in there. Help a sister out. Otherwise, it is miserable. People who just do it straight, I'm like, oh, I don't know. I think we should add a little bit of bicarb in there. But I think that the tumescing part of it is very interesting. If you've not done that before, like it's a whole concoction, I think, is for lack of a better word, which makes it much better for the patient, for their comfort, also long term. But then the idea you can do this individual dimples. And by the way, this is not sponsored by Aveli. I just think the procedure is so cool that I wanted to pick Gilbert's brain, because he's a genius at doing it. He's been doing it for, I don't know, quite a long time compared to everybody else doing it. And I just think it's such a cool idea that we can finally maybe treat cellulite. And as we look at the invoice amount, and I always look at the business side, as you probably know me, if we look at what's happening right now in the marketplace, I look at invoices every day. We probably do 2 million transactions a year at Aesthetic Record. Toxin and filler are dying out on the invoice. If you look at the invoice contribution of a traditional facial injectable practice, they're losing ground as far as like what's the share of wallet for facial procedures, because I think we've almost done those things for so long that many of us are kind of aging out of it. Like it's time for a facelift, or it's time to do biostimulators. So we're seeing the share of wallet change. It's all going to body, Gilbert. It's all going to body. It's going to GLP-1s, weight loss. It's going to even devices like the Emsculpt devices. It's going to things like cellulite. It's going to skin laxity concerns. We're doing biostimulators in bigger areas, more volume. Everyone's focused on their body. And I think we have undervalued for many, many years how important that is, because we were looking at the face. And now it's like we're traveling right on down the body, and we're looking at these big, giant areas, which, by the way, cost a lot more to treat because it's just more, more volume, more area. But also there's just more of it, right? There's just more. There's more problems when you go below the neck. You've got cellulite, you've got laxity, you have all these things happening that I think in a practice in 2024 to compete long term, you have to do these things. Like you're just going to have to figure it out, because if you don't, your neighbor is going to. And if they do it and do it well, you got to be a first mover, in my opinion, always. That's just my thoughts.
I will tell you, the weight loss revolution has single-handedly changed the face of aesthetics without question. There has not been any other medication, treatment that has had such a huge impact on the field of aesthetics like weight loss. It has changed our entire practice. We are now doing probably more wellness than we are aesthetic treatments. And the beauty of it is that they actually now can kind of go hand in hand. And we refer our wellness patients to our med spa providers, and med spa providers will refer some of their patients to our wellness team. And so it has been such a symbiotic relationship. And on top of that, our surgeons are seeing a lot of those patients as well for those individuals that have rapid weight loss that need to have surgery for excessive skin. And so it has been such a game changer in our practice, and we have incorporated so many different treatments. We've created so many different treatment protocols for our patients that are going through their weight loss journey, not just with cellulite, but with skin laxity, with contour deformities. The list goes on, and that could be a show in and of itself, quite honestly.
Well, you're going to talk about some of this aesthetic next because I think you're doing an entire lecture on kind of the aftermath, right? The aftermath of the GLP-1s. When you look at your body and you say, I've lost 20, 30 pounds, yeah, like I'm a pretty small person. That's a lot of weight for me. If I were to lose 30 pounds right now, I'm going to have skin hanging down to my kneecaps. Like that's just a lot of weight for people who are already relatively small. And it's realistic. But we're seeing people losing a lot of weight, a lot of percentage body fat. And if you're bigger and you start losing weight, even more so. I mean, it's just because again, the volume in the area is so much bigger, but you have to start looking at what you do next, right? Is it devices? Is it injectables? What is the thing that you do? Because you have to treat the person after the fact, because to lose all this weight and be so thrilled that you got the weight off, you feel great, and it's like, and now I look terrible. I mean, we see this a lot with gastric bypass patients, right? When they lose all the weight and it's like they've got 10 pounds of skin they have to have removed from their surgeon. It's like you're happy, but just not quite happy enough yet. You got to have the next thing to do. And I think from a business standpoint, it's great, right? That's continuous income. You're going to keep making money, not to be greedy, but you have to keep the practice open, right? Keep the doors open. You're going to keep making money, and they're going to be happier for it, right? Far more satisfied to have a great body afterwards than when they started from the beginning, 30 pounds heavier with nice turgor to their skin, but they were a little chubby. Now it's a different story for them. But when they come into your practice, like when do you, well, I shouldn't say when, but on the GLP continuum, when does all this start? Like they start losing weight today. At what point do you start introducing, okay, we're losing weight. We've got to think about, laxity and cellulite. Like what does the symphony of that look like for you guys in your practice?
We introduce it day one. Like we introduce the idea of skin laxity and educate the patient from the initial consultation. Our goal is obviously to help patients lose the weight that they're trying to lose. But I think Dr. Franco has really made this his passion project. He truly dove into it himself because of his own challenges with weight. And he wants this to be not just something that's aesthetic, but something that is truly going to be beneficial to the patient from a health standpoint long term. And so our goal is to not only help the patient lose the weight that they're trying to lose, but help them feel their best selves and look their best selves, and take care of their health in the long term as well. So we're introducing this from the beginning. We're introducing them to the idea that there may be some skin laxity. Now, not everybody experiences it, and not everybody experiences it to the same degree, but there may be some, or there may be some volume loss. You may have heard of the term Ozempic face or Ozempic butt. And so, there's volume loss that can occur. There's skin laxity. There's loss of support in the tissue. And so, we're introducing this idea to the patient day one. Now, they may not necessarily be ready to initiate treatment that early, but we want to make sure that they're fully educated.
I was just literally thinking in my brain about Ozempic face when you said that. Like we were on the same wavelength because I think there is a huge part for the face too. I think that's why I think we're also seeing Sculptra come in a bigger way because of that. I think for Ozempic face, the Sculptra patient is the Ozempic face, right? That's kind of the whole Sculptra bag is when they're, looking a little lean, little too skinny. And I think there's been a huge push for that as well. As far as like the face, you add that on as well. Now we have a new body, we have a new face, we're feeling great. I just think the whole person feels like they've remodeled their life and they have you to thank for it. And so I think from a loyalty perspective and long-term retention, you couldn't ask for, I mean, it's a silver bullet. You couldn't ask for a better option for a patient to fall in love with you if you've made their face and their body what they want it to become. I just think that's such a huge part of it. But on the Ozempic face part, back to that, what are your preferred treatments or things that you like to do when you have a person come in who's looking a little raggedy from all the weight loss?
So well, I say we, I take some credit, but really it's truly Dr. Franco who kind of created this protocol. He calls it our structural sandwich. And so essentially it's utilizing biostimulatory fillers on the injectable side underneath the tissue in the dermis to stimulate collagen, and then using an energy-based device on the surface to stimulate collagen from the outside to create that collagen sandwich, so to speak, and just really try to help recreate that structure, that support in the tissue. And with those can sometimes come some volume retention as well, and some volume or revolumization, I should say, without having to utilize anything that's going to make the patient look too full, because obviously they wanted to lose weight for a reason. So we don't want to inflate them again, right? So, using the body's own healing mechanism to kind of help create that more natural look.
Folks, this is what you get on the podcast right here. Cool, unique, novel techniques. No, this, not to like hit on the AN6 thing again, but this is what you learn. When you go to see an expert talk about things that they do every day, you learn things like this, the structural sandwich. We got to get a better name though, Gilbert. You can't trademark that name. But those are things that if you're going to a free class by a manufacturer about a product, you will never hear that. Or to someone who may be injecting for a long time, but they've not really they've not dove yet into like the underlying structures and more of the science behind all of it and why you do what you do and what things work together. You go to a person who's been doing this for a long time and knows about skin and structure and the surgical aspect of it, and you get these really cool things that just work, and they work in a different way, and it's not traditional outcomes. And that's why if you look at your Instagram right now, Gilbert, I will tell you, I posted your picture on our AN6 faculty reel, and people were just like so proud of you. I love you. You're wonderful. You're the best. My God, the fanfare, the freaking fanfare for you. I thought, man, this guy's, he might as well run for president because he might win. Right now, he might win for real, but people are coming out of the woodwork. And so I think your patients just, they adore you. They love you. You're in a very competitive market in Austin, but you're doing these things that are different and unique that set you apart. And I think without that in this 2024 timeframe, it's just going to be hard to win. But I love the fact that you're doing novel things. It makes me so happy. I love to hear people who are doing things that nobody else is doing and doing them in a good way. So I want to come get a sandwich. I need one of those sandwiches.
I was just saying we've got other really cool stuff coming in very, very soon. I can't really touch on it quite yet because we haven't been given the green light, but in the very few upcoming days to weeks, we have some really, really cool stuff coming our way.
Oh, I'm going to be glued to your Instagram to find out what it is because inquiring minds want to know. But let's talk about that for a second, about you having such great fanfare. You are in Austin. I think I put this in our little overview. One of the most competitive markets in the country for med spas. It's a cutthroat market down there. And people literally love you, and you're very, very busy. How do you survive in Austin? Like, is it these kinds of things that set you apart? Is it reputation, just longevity? What do you do that makes people just literally come on Instagram, your patients, and throw the love your way? Like, how do you achieve those results?
First of all, thank you. But I don't know. I got to be honest. I think for me, it's really just being genuine with the patient and just being transparent. I spent a few years of my career in family medicine before I got into dermatology, and that experience kind of molded my way of thinking, I guess, in that, you treat your patients like you would want to treat your own family, or at least that's the goal, to try to treat your patients like you would treat your own family. And if you do that, then they become your patients for life, really. And so I think just treating them with respect, being genuine, being transparent with, what you can and cannot do. I think that just kind of speaks volumes and carries, over the patients. Really, they garner a lot of trust in you because of that, I think. I've had so many patients that have told me, you know what, I really appreciate you telling me, that this is not going to be in my best interest. No one has ever told me that. I really appreciate you guiding me in the direction that, maybe an injectable treatment is not my best option. Maybe I do need to see a surgeon to get best outcomes. And so I don't know. I think just being genuine with the patient, being honest, being transparent, thinking of the patient as like if I were treating, my aunt, my cousin, my mom, my dad, my brother, just that I think in and of itself has really helped me, I guess maybe grow my practice, and maintain my practice, retain the patient volume that I have. And really in the end, it really just makes me feel like it's fulfilling my sense of purpose.
Yeah, you're part of their family, they're part of yours. Well, and I also think too, as you've grown your career, you're adding things that we are adding as patients too. As we are maturing, you're maturing with us, right? Where we now need cellulite fixes, we need body contouring fixes. Like I think you guys are evolving. I think that's part of one of the cool things that being in a surgical area or surgical practice is that it has to stay cutting edge, right? That's just by nature of what it is. You have to be on top of all the trends and be on the forefront. And I'm sure there's some byproduct for that of you also being able to get access to things and see things that are different and unique and for the first time because of where you are. And if we don't innovate and evolve with our patients as they innovate and evolve in their life, I think you get left behind. I just think at the end of the day, you got to be you got to do whatever they want you to be in that moment to keep their attention. But also, and I'm going to speak without knowing the answer to this, Gilbert, at all, and I'm probably dead wrong, but who knows? I feel like because of where you are, the price is the price, and there are no like backdoor deals or like bargain basement. I think when you set up a patient population that's used to getting these like, give me this for that and this for that, I think they don't stay long term. It's like it becomes like a flea market where you're bartering versus coming in saying, I have an expert provider, I need help. This is what I want to have done. Can you do it? Yes, no, let's pay for it. We're good to go. I think it sets up a relationship that is different than when you are doing this like wheeling and dealing thing because they always go somewhere else to wheel and deal with somebody else too. It's like they don't love you, they love the bargain. And I think for you, they probably love you, forget about the price tag of all of it.
Exactly. Yeah, I couldn't agree more. I think if you want to develop a patient provider relationship that's going to like stand the test of time, so to speak, you really have to kind of take that approach as opposed to, like you said, do some backdoor wheeling and dealing under the table kind of stuff.
And you may grow slower, but you'll grow faster longer. I feel like you may have to tell a few people no in the beginning, but the ones that you keep will stay with you for a long time. And I'm sure you've got patients that have been with you for 15, 20 years. I have no doubt.
It's all about longevity, right? It's about the 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 big picture, the long game, so to speak.
Yeah, because it costs a lot to retain, or it costs a lot to acquire a patient. To retain them is like, in essence, kind of free if you do good marketing. You send an email and a text here and there, and you get to keep them. There's no more acquisition. I think in plastics, for sure, acquiring a plastics patient is very expensive, right? That cost of acquisition is really high. Luckily for us in med spa world, it's not quite so bad, but it still costs money. And I think it's just also a lot of work to field leads every day and have to start over with new consults every time. And if they know you and you know them, I think it's like a putting on your favorite old sweater, right? It just fits and everything just kind of
Yeah.
works together. But to that point, question for you, which might be a controversial one, but you are working in a practice and have been for a long time. Everyone else wants to run as fast as they can to go build their own. And I'm like, slow down, sister. You don't want it. Trust me. What was your decision making process as you went to this next practice with Dr. Franco to do that versus opening your own place?
So I'm very, very fortunate in the regards that, I get to work alongside my best friend. And so I don't think a lot of people have that benefit. And so the fact that, I know he has my best interests in mind, and I'm obviously going to do everything in my power and my abilities to make sure that his practice is running efficiently, and I'm doing everything I can to take care of his patients as best as I possibly can. That too is kind of like a symbiotic relationship, and really, I mean, he has provided so many opportunities for me. I've created some of my own, but with him as kind of being the catalyst, it's really just been a work environment that why would I want to leave? Like, why would I want to leave that? It's just been such a great working relationship with him. And like I said, we've been good buddies for such a long time. It's like getting to work with your friend. That's pretty cool.
Yeah, I think entrepreneurship it ain't half bad. I do it here too. And there's also just infrastructure there. I think, when you have a plastics partner, again, devices and things, they tend to get them before we do often in the med spa world. They kind of get the first stab at many things. And you probably have access and even like FDA trials and things. I think they love to have a surgeon on a trial and facility with like, surgical ratings and things. There's just differences that no matter how great you are, and you could be the most phenomenal medical spa in America with the most amazing injectors ever known to man, you just don't have the same access because of location and where you are in the specialty. It's just the way that cookie crumbles when it comes to FDA trials and such, that you just can't get them at using a med spa. You have to get them at a surgical or dermatology office. So I think there's always benefits there. And I agree with you. I think sometimes working with people that you like and enjoying what you do and not having the stress of owning everything is such a benefit, because you get to really focus on patients and the things that you want to do and how you want to do them. I think that's really important. But you mentioned non-compete earlier. That's like, obviously the hot button right now. Everyone's talking about the non-compete contract. And I'm like, you know what? I get it. It's a huge deal, but at the same time, like, find a place that you love and go stay there with people that you want to work with, do the things you want to do all day.
And he's very encouraging about my professional growth. Like he encourages me to submit abstracts to conferences to present. He encourages me to do trainings with different companies to kind of just grow professionally. So really, it's a great working environment. It's a great situation to be in. I have no reason to want to change that at all. So,
Well, I'm sure that it's good that you're not, because you got a lot going on there. But I wanted to talk before we get off of our podcast here about your podcast, because I've been doing some digging about Plastic Surgery Untold, and it's a group of you. And I have to know, I put this in our little overview as well. They have coined you on the website as Austin's most gorgeous man, which I love. I want that on my headline on my website. Like, I feel like I'm getting screwed here, people. But no, I love that. It seems like it's a very fun podcast. You guys talk about different things, different treatments for patients and what to watch out for and look for. Give us a bit of an overview of that podcast, because I want to tune in and listen to it starting like today. So tell the audience what it's all about.
yeah, absolutely. Well, I'll get to that in just a second. But so Plastic Surgery Untold started about 4-ish years ago, and it was originally just 4 of us. It was myself, Dr. Franco, one of the CRNAs that worked with us very, very closely, and then we had another host who she was kind of like an influencer, and she kind of brought the female energy into the podcast. And it started out as a way to just really like engage with our patients and engage in the community, talking about different things regarding plastic surgery and how it applied in different aspects of life. And that kind of gradually evolved, and it's grown so much over the years. And now it's kind of morphed into this like really cool educational kind of podcast where, we bring on different plastic surgeons from across the country talking about what they specialize in. We have our own providers on the podcast talking about different treatments that we're bringing on to the practice, different devices that we're bringing on, different treatment protocols that we're putting together for our patients. And it's just really become more of a resource for patients and the general public for those burning questions that they have regarding aesthetics and plastic surgery that maybe they didn't know who to ask or they didn't know what to ask. And they can go and listen to our podcast and just get as much information as they want to take in, and take that for what it is, and then use that information to their advantage.
Well, I'm guessing also, if you're a provider, it's a great resource for you to know what's hot and what's up and coming and the trending things that are going on in the surgery world. And I envision for your patients, like, what a huge resource. They feel like they know you already. They know what you're about. They hear you on, it's like the podcast. People come up to me and say, oh, I love so-and-so episode. I'm like, they hear this all the time. They know who we are. They know what we're talking about and the things that we care about, because we say things. I mean, I say a lot of the same things, I'm sure, every week, because it's like hot buttons and TED Talks. But I feel like it's such a great way to connect with your audience. And I think people who do these podcasts, I've heard from everyone that does them, that they connect with their audience really well. Like, patients start to kind of understand things they couldn't understand before, and they get a whole hour to talk about it, or 30 minutes, and they learn and they grow. And It's just a cool way to build a community. But I can just imagine if I'm a provider right now listening to this, I'm a nurse injector, like I should go listen to every episode to figure out what's the trending topic and what are the big things happening in the industry that I should know about, but also for my patients too. Like I don't even know what I'm referring because I don't know what all can be done. This is probably a way for me to find out what are the things that can be done in a surgical office that I could refer out because I can't give the right result to what you said before. I can't achieve what I want, what they want to achieve. So what a resource. Everyone go download it, go follow it. I'm sure it's on Spotify, Apple, all the places.
Pandora, and we have our video version on our YouTube channel. So yeah, we'd love for you guys to come and listen. I think it's really great because, like I said, not only is it a great resource for patients to just absorb as much information as they want, but it also helps us, the providers, on the other side because patients come in with all this information already. It cuts our consultation time literally in half because patients are like, oh yeah, I heard that on the podcast, or oh yeah, I saw that on your Instagram. Just I want to know like when can I schedule it? So it's such a great resource for the patient, but equally for us as well because it makes our day so much more efficient too.
And if a patient of yours somewhere, if you live in Minnesota or wherever else, happens to see this and they hear about things and come in and ask you about it, and you don't know the answer, that's a concern. So I like to know what's going on everywhere around me. Gilbert, I hate to be the person who doesn't know the answer in the room. Not the smartest one, but just at least cognizant of what's happening and at least aware. Awareness is a good thing to have. I think things like this help you to be aware. If you're not living in a place where you have access to surgeons in your market, you're not talking to them every day, to hear what's all out there, what's up, like even Aveli, like what's up and coming, what are the big things to do, and what are people who are doing this every day doing instead of what you're doing. I just think there's such a great place for us to learn, and hearing it in patient verbiage, it's just so different, right? To hear what a patient asks versus what we talk about with each other, in trainings and such, it's just so different. So yes, go follow it. And I would do the video because apparently Gilbert is Austin's most gorgeous man. So you must watch the video. And this is going to be on video as well on YouTube or Spotify. So if you're not watching it on video right now, tune in. I just love that. I'm sure that's probably a friend thing with all of you guys knocking around different fun things, but that is now your moniker to me forever.
It started out as like a gag nickname that Dr. Franco gave me in the inception of this podcast, and it kind of just stuck. And it is what it is, I guess.
Hey, if it's not fun, don't do it. It's life's too short.
Exactly.
Well, give us an idea of Aesthetic Next, what all you're doing, because you got some fun things going on. So if you're listening to this and you're like,
Yes.
Gilbert's a genius, I got to go, don't worry. We can get you access at Aesthetic Next 6.0. So tell us what all you're going to be doing there.
I'm really, really excited to be participating in Aesthetic Next 6.0. I don't know if you knew this or not, but my first introduction to Aesthetic Next was the inaugural meeting, and it kind of at that time in dermatology, I was kind of doing a lot more clinical surgical. It reignited my passion for aesthetics. I don't know if you knew that or not. I don't know if we had talked about this before or not, but it truly reignited my passion for aesthetics because I had kind of let the aesthetic side of my practice kind of fall by the wayside a little bit, which unfortunately, I can't believe I let that happen. But I just was focusing more on clinical and surgical dermatology at the time. But it really just kind of made me find the love in aesthetics again, and it just kind of changed the trajectory of my career. So thank you for that. But I'm super excited to be a part of the Aesthetic Next 6.0, be on faculty this year. I'm going to be doing 3 different presentations. One of them is a presentation on skin laxity post weight loss success and how we approach treatment for those particular types of scenarios. I'm also doing a really, really cool live demonstration of Aveli on stage, where we're going to be doing a procedure from beginning to end, from the consultation to the anesthetic component, showing the audience how we do the anesthesia, and then going through the procedure itself. We'll also have some learning didactic component to that as well, and there'll be some time for questions, of course, because I hope there's a lot of questions. It's such an amazing treatment, and I can't wait to talk about it. And then we're rounding out the weekend on a really fun panel with some other really amazing expert aesthetic providers talking about how we would approach treatments for specific patient presentations, doing some before and after photos as well.
Yeah, I've not seen Aveli injected or not injected, but done live yet. And so I'm very excited. People ask, like, what's your thing you're looking forward to most? I'm like, I want to see this demo. I want to see Aveli in the flesh, literally on screen, and watch it be done because I just think it's such a cool thing. And I've heard about it. I happen to know the CEO. She was a panel moderator for me many years ago, and she was talking about going to this company. And I was like, oh, I got to see this thing. But I think that the battle royale, as we call it, it's like, I think it's you and Shino, Christian Subio, Kimi Ragone. If you guys were here last year, we put pictures on stage. They kind of battle it out of what they would do with the patient, and then we show what actually happened. And the person who did the treatment talks through why they chose what they chose. And they critique each other, like, well, I think I would have done this differently. And Subio is ready to tear your before and afters apart. So I'm just going to tell you right now, Gilbert, have a good before and after. He's ready to come in with his guns ablazing on those BNAs. So make sure they're good. But now I think you've got a really cool lineup, and I think the skin laxity session as well, because as you mentioned before, it's revolutionizing aesthetics, and you have got to know how to solve that next problem if you solve the first problem of weight loss. And so no one better to talk about it than you. And I think you're going to have, I don't know, the live demo. I'm just really jazzed about the live demo, guys. And guys, I love a live demo, but this is going to be one that's really cool. So we are thrilled to see it all come together in a few short weeks. Oh my goodness.
So soon, yeah. I'm so excited.
Me too. But beyond that, give us any ideas of what's coming besides the things you can't talk about, your non-disclosure things. Anything else we should be looking out for?
Yeah, I'm excited. There's a few other conferences that I've got lined up this fall. I think we're doing a presentation locally here for the Texas Society of Plastic Surgeons. We do an injector course at this conference that we kind of help put together. So excited about that. Hoping to bring in some ultrasound presentations, maybe some demonstrations, just kind of beginner basic type stuff to kind of introduce the idea of ultrasound to injectors. Also doing a presentation with Dr. Franco at the MAP conference this November on wellness. I'm hoping to travel to London again this October to partake at the CMAC conference, third annual. Such a great conference. I can't speak enough great things about it, but those are all the things that I have currently for the end of the year. I have also submitted a few abstracts for some other international conferences, but I probably won't find out about those until later in the year. So really excited about those opportunities if they happen to come to fruition.
Well, and as we end here, I want to encourage all of you to do that. The international conferences love to have Americans come talk because we do things in such a different way. We're a huge part. We're the majority of the market for aesthetics, and they want to hear our perspectives. In many cases, we're way behind what they're doing, but we also have, because of what we have access to, which is far less than what they have access to, we are much more we've got some good ingenuity because we can make things happen that they can't because they have every tool in their armamentarium that you could ever want in your life. So they do want to hear from us. So I love that you've put in some abstracts. If you haven't done it yet, guys, and you've got things to talk about and things to say, go put one in because I have friends who get chosen every year who've traveled to MCAS or Monaco, and they speak about things that here it's like our normal conference conversations, but there it's like really novel because it's an American talking about it. So I encourage you all to go do that, put those in, and justify a nice trip to Monaco, or to Paris or anywhere else. It's like, put on the company credit card. Life's good. Moving on. But yes, go do that. Well, I'm thrilled to see I don't know, I shouldn't say continuum, but what you're doing every day. And you're doing some really cool stuff. I follow your Instagram, obviously, and seeing all the things and your patients being so happy and what you're doing with Aveli and with body contouring and laxity. I think it's just really cool and innovative. But I'm staying tuned for your announcement in a few days. I cannot wait to hear that. But tell all the rest of us how to find you on Instagram, and if you have a website as well, tell us that too.
So you can find me on Instagram at PA_Gilbert Saenz, GILBERTSAENZ. If you guys have any questions about any of the things that we talked about on the show today, I'm happy to answer those. Really excited to share more about these topics at Aesthetic Next 6.0. But yes, reach out to me on Instagram. I don't have my own personal website, but you can find me at our practice website, austinplasticsurgeon.com.
Which is a great website with lots of cool BNAs and things you can watch or things you can see. So go there too. And I'll put all this in the show notes as well as a link to Gilbert's schedule for Aesthetic Next. Make sure that you're there, get your tickets. It's going to be great. And with that, Gilbert, I'm going to sign off for the week. Thank you for coming on. I appreciate it and sharing all of your brilliance.
Tiffany, it's been such a pleasure. Thank you so much for having me. Maybe we can do it again next time.
I hope so. Well, I'll see all the rest of you guys next week for another episode of For the Record. Bye, guys. Thanks for listening to another episode of For the Record. This podcast is not intended to provide legal or medical advice. It's for entertainment, education, and information purposes only. For more information on this week's guest or to get started with Aesthetic Record, email us at info@aestheticrecord.com. Be sure to tune in next week for more fresh perspectives on disrupting the status quo and surviving in the aesthetics industry.